Ankylosing spondylitis, hip pain, causes and treatment. Ankylosing spondylitis often causes hip pain. Some evidence suggests that the hip is the second most common area where ankylosing spondylitis symptoms begin. This information comes from a 2022 study of 60 adults with ankylosing spondylitis. Ankylosing spondylitis is a form of spondyloarthritis. This is a type of inflammatory arthritis that specifically affects the joints and ligaments. It most commonly affects the spine, but it can also affect the pelvis, buttocks, neck and other joints. Watch on to learn more about ankylosing spondylitis hip pain, including what it feels like, treatment options. What ankylosing spondylitis hip pain feels like? Ankylosing spondylitis often causes stiffness and pain that worsens with inactivity. The pain may improve when a person moves around and be at its worst after sitting or lying down for a long time. Overactivity like strenuous exercise can also trigger these symptoms. When a person has ankylosing spondylitis induced hip pain, their pain typically occurs in the sacroiliac joint, which is where the bottom of the spine meets the pelvis. The pain may move from side to side or affect both sides. Why does ankylosing spondylitis cause hip pain? Ankylosing spondylitis is a type of inflammatory arthritis, meaning the disease causes joint inflammation which causes pain. Inflammation is part of the body's immune response to damage or injury. Usually it rises while the body heals, then gets better on its own. But in ankylosing spondylitis, the inflammation remains high. Scientists are not sure why this happens, but research suggests there is a genetic link. Many people with ankylosing spondylitis have a gene known as HLA-B27. This gene seems to raise a person's risk of developing ankylosing spondylitis, but it does not guarantee they will. Treatment for ankylosing spondylitis hip pain. There is currently no cure for ankylosing spondylitis. However, treatment can help relieve pain and stiffness. It may also slow or stop the disease progression. The ultimate goal of treatment is delaying complications and joint damage. Treatment may involve a combination of medications. Medications for ankylosing spondylitis can include non-steroidal anti-inflammatory drugs such as ibuprofen, naproxen or diclofenac. Tumor necrosis factor or TNF blockers, interleukin 17 or IL-17 inhibitors, JAK inhibitors. People can take non-steroidal anti-inflammatory drugs orally. Non-steroidal anti-inflammatory drugs come with some risk, including gastrointestinal bleeding and kidney injury. People receive TNF or tumor necrosis factor blockers and interleukin or IL-17 inhibitors as injections or intravenous infusions. They suppress the immune system, meaning a person is more vulnerable to infections. Physical exercise. Physical therapy is an important part of ankylosing spondylitis treatment. Some types of exercise that may help include range of motion exercises. These exercises involve moving the joints through their full range of motion. Practicing these exercises daily can help reduce stiffness and maintain mobility. Low impact aerobic exercise. This includes activities like walking, using a stationary bicycle, or water aerobics. For the latter, aerobic exercise, the water provides gentle resistance while reducing the gravitational impact on the joints. Strength training. Stronger muscles can support the joints, including the spine and hips, more effectively. Try to do strength training 2 to 4 times per week with rest days in between. Balance training. Balance training can also strengthen the muscles, particularly the smaller muscles in the body. Try to perform these exercises 3 to 5 times per week. A physical therapist with exercise in ankylosing spondylitis can help people create a tailored exercise plan. If any exercise worsens ankylosing spondylitis symptoms, it's important to stop and rest until the symptoms improve and contact a health professional for advice. Ankylosing spondylitis hip pain at night. Ankylosing spondylitis hip pain may worsen when a person lies still, which can wake them up at night. To try and reduce the pain, invest in a high quality mattress that distributes body weight evenly. Replace sagging or overly soft mattresses. Pay attention to sleeping position, as this may be exacerbating pressure on the hips. Try sleeping flat on the back with a thin pillow or folded towel under the head. Avoid sleeping on the stomach. Hip pain in ankylosing spondylitis is common. It may affect the sacroiliac joint, where the spine meets the pelvis bones. Although it's not the most common place where ankylosing spondylitis begins, it can be where the pain starts. With treatment, many people with ankylosing spondylitis can manage their pain and have fulfilling lives. If the pain is significant despite all of these tips and intervention, be sure to contact a doctor.